cucumber juice or like a cold soup that's blended with cucumbers. That sounds incredible. Thank you for sharing all your recipes with us in the chat. Getting some great ideas here. So we'll go ahead and jump into our call because we have a packed agenda today. But for those just joining, we're asking people to introduce themselves in the chat with their response to our ice warmer question, which is, at the end of a long day, what's a recipe you know you can rely on for a quick and easy meal at home? All right, so I think I know most of the folks on this call, but we also have some wonderful pantry partners joining us today. So I'm going to do a quick introduction of myself for those of you who I may not have met yet. My name is Lucy. I use she, they pronouns, and I work with the Alliance for Health Equity, which is based out of the Illinois Public Health Institute. I'm joined by a few colleagues on the line today, Jess Lynch, Rashida Balogun, and also Madiha Sayyiduddin. So thank you so much to my colleagues who are joining. It's so wonderful to be here with everyone today. Thanks for responding to our ice warmer question, and we'll go ahead and get into our agenda. So today's call is going to feature a presentation from our partners at Larry Children, specifically Megan. We're really excited to hear her chat about their pantry partnership model. But first, before we do that, we're going to do a quick breakout group discussion with the activity that you all prepared. And then after Megan's presentation, we'll shift into a group discussion about how we can foster support for pantries within hospitals and healthcare systems before we wrap up and move into next steps. So as we're getting started with the meeting, I did want to share a quick review of our food action agenda. So I'm sure folks on the line are very familiar with our action agenda, but for those of you who are new to the work we're doing, this action agenda was developed in 2019 under the leadership of Dr. Angela Odoms-Young, who worked with community members across the city and county to get a sense of what their needs were related to food and nutrition. And from that work that Dr. O did, we put together this action agenda, which we've been stewarding with our partners over the last several years. A lot of the goals we identified back in 2019 have remained current, of course, in light of the COVID pandemic. So as you can see, we've set out items for ourselves related to community partnerships, economic policy, and screen, refer, and partner. We also have a work plan where we've laid out activities for this year related to advancing these goals. You'll find the action agenda and a link to the work plan in the slides, which were sent out before today's meeting if you'd like to take a closer look. And now as we start to transition towards our breakout group discussions, we wanted to ground folks again in some of the really important work the Alliance has been doing with you all around advancing our food action agenda, which is really to take an intentional look at how race and health equity can be advanced through food and nutrition access. So in the framework here, which we worked to share with you all starting last year, this framework is created in partnership with Proviso Partners for Health and the WIN Network. We are looking at this framework to understand how we can advance awareness, action, and the power to transform at multiple levels. So each of us has the capacity to do that at the individual level, the collective level, the outcomes level, and the systems level. And when we're looking at this framework, it really reminds us to not only think about how race and place affect food in the work that we each are doing as individuals, but how it affects the work we're doing within our organizations, what the outcomes are that we're striving towards, and how we can also create systems change when we start to think about advancing race and health equity in food and nutrition access. So this is just one tool of many that really grounds us in the why of the work that we're doing. And this is a resource that we like to bring up before we go into breakout group discussions focused on race, place, and food. And then on the next slide, we have another resource called the Window of Tolerance. Again, this is a tool we shared for the first time last year, but we're bringing it back again today. So the Window of Tolerance is a really nice tool that helps us as individuals take an assessment of how we're feeling moving into discussions around race, place, and food. So within our Window of Tolerance, as individuals, we are feeling really confident carrying on with our daily life. As you can see in the middle of this graphic, the waters are pretty calm. We're feeling capable and in control. But sometimes when we enter into discussions that are challenging for us based on past experiences, based on our identities, we might move up or down in our window. So if you move up, your waters might become choppy, or you might feel feelings of hyperarousal or being a little bit overwhelmed. Or sometimes you might drop in your window and start to move towards being a little bit numb or feeling low energy, which is seen on the bottom of the graphic here with like the really flat water. And so we share this as a tool to just ask everyone to take a moment to just check in with yourselves and see how you're doing today. If in the breakout conversations, you feel like you need to step away from the conversation for a little bit to take a bio break, get some water, take a stretch, please do. We really want everyone to engage in the conversation to the best of their ability, but also make sure that they're tending to their own needs. So with that all being said, we are going to start the breakout rooms here in just a second. So as a kind reminder, we asked folks leading up to their meeting to review a number of different resources. That one resource that you reviewed, we're going to ask you to join a breakout group for that particular resource and then chat about these discussion questions. So what did you think of the resource you reviewed? What did you find the most interesting? Or what did you feel the most challenged by? Maybe you could answer both questions. And then how might what you learned apply to your work? So again, I'll read through these questions and I'll also put them in the chat so that when we move into the breakout rooms, everyone will have access to them. But once you join the breakout group focused on the resource you reviewed, we're going to ask you to chat about these questions in your group. So what did you think of the resource you reviewed? What did you find the most interesting, or what did you feel the most challenged by? And how might what you learned apply to your work? So I'm going to go ahead and stop sharing my screen. I'm going to put the questions in the chat and open the breakout rooms. So just bear with me a moment as I take care of this. Thanks, everyone. All right, so the questions are in the chat, and I'm going to work on opening the breakout rooms now. Give me 1 second, folks. Okay, so what we're going to do is move into the different rooms based on the number resource you reviewed. So I'm going to read these out. So room number 1 is the room you should join if you read the article called Knee High by the 4th of July, Planting King Philip Corn on Wampanoag Land. Room number 2 is the room you should join if you read Indigenous Farm Workers Can Show Us How to Heal Our Burning Planet. Room number 3 is the room you should join if you watched the video called Explained, the Racial Wealth Gap. Room number 4 is the room you should join if you read the article called Racial Disparities in Access to Running Water. And room number 5 is the room you should join if you read 7 Ways to Fight for Food Justice. So if you need help joining your rooms, what you want to do is go to the bottom of your Zoom window and you'll see an option that says breakout rooms. If you click on that option, you should be able to manually join the room number that corresponds to the number resource you read. And I will read out those room numbers and the corresponding resources one more time. So room number 1 is for folks who read Knee High by the 4th of July. Room number 2 is for folks who read Indigenous Farm Workers Can Show Us How to Heal Our Burning Planet. Room number 3 is for folks who watched Explained, the Racial Wealth Gap. Room number 4 is for folks who read Racial Disparities in Access to Running Water. And room number 5 is for folks who read 7 Ways to Fight for Food Justice. And if anyone needs help with joining a breakout room, please feel free to come off mute and I am happy to troubleshoot with you.
I logged in late. I don't see breakout rooms.
No problem, Leslie. Did you have a chance to review one of the resources we shared?
I did not. I'm just logged in about 30 seconds ago.
Okay, no problem. So yeah, we shared out a couple of resources online. If you're interested in listening on the discussion, I could move you to a room if that sounds good.
That sounds great.
Okay, perfect. I'm gonna move you to a room right now. Give me 1 second.
Okay.
All right. Thanks, Leslie. You should have gotten an invitation to join a breakout room.
I just did.
Thank
I
you.
can listen.
All right, Karen, thanks. Karen, I'm gonna move you to a breakout room talking about the racial wealth gap, if that's okay. All right. So Saria, Rashida, and Philip, feel free to jump into rooms as you'd like. Otherwise, we'll see you back here in like 9 minutes.
So I just read the first.
So it's my great pleasure to introduce Megan with Lurie Children's Hospital. Megan today is going to be talking to us about Lurie's pantry partnership model, and we are so excited to hear about the amazing work that they are doing. So Megan, thank you so much for joining us today, and I will pass it off to you.
All right. Thank you so much for having me, Lucy. For those of you that don't know, Lucy and I used to work together at Lurie Children's Hospital for a hot minute. So I always appreciate seeing you, pushing the work along. All right. I'm going to share my screen. Just bear with me while we get that going. All righty. So I introduced myself in the chat, but I'll do it again. I'm Megan. I go by she, her pronouns, and I work for the Food Act. Actually, before I really dive in, how long do I have, Lucy?
You
I want to
have
be
25 minutes, Megan, so please
okay.
do whatever you'd like with that time.
Okay, perfect. Because yeah, as some of you may know, if you've ever been in a meeting with me, I'm a bit of a talker, so I need to make sure that I am not going over my time. All right, thanks so much, Lucy. So I work for the Food Activity and Nutrition Initiatives program at Lurie Children's Hospital. So we are housed in what we call our Magoon Institute. So the Magoon Institute is all of our community-facing programs at Lurie. So we do some work with our patient population, but for the most part, our Magoon programs, fan included, are out in the community doing work. We work a lot with schools on healthy CPS. I've been working with the Chicago Park District on some summer camp programs and, looking into creating like a health hub model in Austin. We do a lot of advocacy work. Some of our other programs include unintentional injury prevention. So car seat, booster seats, bike helmets, playground safety, that kind of stuff, water safety, sexual health and gender inclusion education, violence prevention, mental health, in our Center for Childhood Resilience. So we have quite a few different programs running. So FAN is just one of those programs. So we are housed in Lurie Children's Hospital. Today, I'm going to be talking to you about our pantry partnership model. This is a program that is being run in collaboration with Westside United, and I'll provide a little bit of context around that for those of you that may not be familiar. But first, I wanted to talk a little bit about how this program can support the proposed Illinois healthcare transformation, section 1115. So as some of you probably know, the proposed extension is to transform the state's Medicaid program and incentivize a holistic approach to supporting healthcare. So it includes things like housing support, behavioral health support, social services connection. You can see, food and nutrition services, all of the things that are listed here on the slide. So that this type of programming and case management would be covered as long as a person is enrolled in full scope Medicaid coverage. So they would be eligible for these types of programs. So some of the proposed initiatives for the food and nutrition services piece of things are here on this slide. So I'll just quickly review. The ones that I've bolded in blue are the strategies that this pantry partnership program can support. We also have some other programs that have been piloted or are being piloted soon at Lurie that are also included in this proposition. But for the pantry program, definitely assisting in identifying healthy foods and permanent food sources. As part of the pantry program, we work with our pantries to ensure that they're doing benefit enrollment. That's something that we also do at the hospital. So that is also included, a stocked refrigerator and pantry when transitioning out of the institutional setting. So again, connecting with a food pantry in that capacity, and meal and food support from food banks or other community food-based programs, provided that such supports are not being received through any other program. And we do have a medically tailored meal program that's going to be starting up soon. And we have done a pilot with Westside United, Bethel New Life, and 40 Acres Market around fruit and vegetable prescription. So we're working on a lot of these different areas, although today I'll be focusing on our pantry partnership model. Oh. All right. So the pantry partnership model is a strategy that's part of our food pantry initiative group that is a subgroup of the Westside United Food Access Strategy Group. So for those of you that don't know, I think probably most people on this call do, but Westside United is a collaborative of 6 hospital institutions, all working collectively to reduce the gap in age of mortality that exists between Westside communities and downtown communities. So there's a lot of different programs that are working to do that. There are health screening programs, there are economic development programs, there are workforce development and healthcare pipeline programs, and food access is just one of the umbrellas housed under Westside United. So Lurie is leading that work because of our food activity and nutrition program. So the overall goal of the group is to improve food access on the West Side, of course, and also to screen all of our patients for food insecurity. So do those social determinants of health screenings with our patient population, make sure that all 6 institutions are doing that across the board. And that if a patient is screened as food insecure, that we have a strong network of programs that we can refer them to. Some being home delivery programs, some being on-site pantries, the Veggie RX program I mentioned earlier, the medically tailored program, for folks that have a specific chronic condition that would need a medically tailored meal. So those are some of our other programs. But the food pantry work group is meant to be an additional resource for our patients and families that need access to food. So the group was created in 2019, and the thought was initially, let's pair these highly resourced institutions with food pantries on the West Side that are often, volunteer run, operating on shoestring budgets, and, really doing a great job of feeding the community, but could certainly benefit from getting some additional resources that the hospitals have access to. So we worked with the Greater Chicago Food Depository to identify some pantries that may be interested in partnering on this initiative. And we started by doing a needs assessment, just seeing if it was a good fit, who was willing to work with us, who had the capacity, with the hopes that, we would be able to eventually recruit a pantry from each of the Westside United communities. So our pantries right now represent 6 of the Westside United communities. They serve the entire population. So, food pantries often have select zip codes that they are able to serve. So our Pantry Collaborative does serve all of our Westside United communities. And in fact, they serve all of Cook County, although the physical locations, we are representing 6 right now. So the goal is to represent all 10 of the communities. So we're working towards that as we get more funding and things like that. All right, so we have some goals that we're working on as a group. As I mentioned earlier, making sure we're screening our patients for food insecurity and then referring them to our pantry partners. We are piloting a closed loop referral program. So we're working on that right now with Lurie and 2 of our partner pantries, so that we can use Unite Us to track our referrals to our pantries. So our pantries are being trained in how to use Unite Us and how to close that loop on the pantry side, and they're receiving a stipend to do so through some funding through ConAgra. And right now I'm working with our social service and information management team to determine how we'll prioritize our Westside United pantries in the Unite Us system, so that when our social service folks screen somebody and they have that need, that our Westside United pantries pop up or there's a little logo next to it. So we know this is a pantry that's part of the closed loop program. So we want to try to make the referral there if it makes sense, geographically and works for our patients. Part of the reason we want to prioritize the Westside United pantries is because we are working on these key pantry characteristics together. So we know that the pantries that are part of the Westside United Food Pantry Initiative group have a lot of fresh produce options and nutritious foods available, because that's something we're working on collectively. We know that our partner pantries are leading advocacy efforts. They're taking the healthcare referrals. They're doing benefit enrollment and nutrition education on site. They often have summer meals available as well. So we know that there is really robust wraparound services being offered at our partner pantries, and that they have the capacity to take on new clients and offer a wide variety of healthy options for the folks that we're able to refer there. So these are some of the things we work on as a group together, and we are funded to do so. When the group started in 2019, we were meeting about 50% of these. So across all of it was 6 initially partner pantries that we were working with, we were hitting 50% of these key pantry characteristics. And in 2023, we were up to 77%. So we're always, striving towards achieving these characteristics as a group. We'll likely be adding some additional characteristics as we've worked together and through our monthly planning meetings that we have as a group. Additional needs arise as things change. We went through a pandemic during this time, additional needs come up. So we are definitely considering adding volunteer recruitment as a key, and like strong volunteer representation as something that we work towards together as a group, as well as closed loop referrals, something that we're piloting right now, and local food procurement and the good food purchasing program has been coming up a lot in conversation lately. So that may be something that we start to work on as a group as well. All right. We also do evaluation with our food pantry partners. We want to make sure that this is a mutually beneficial partnership for the hospitals and for the pantries. So we have a goal that 100% of the food pantry partners will report an increase in capacity and a benefit as a result of participating in this partnership. And we have been able to meet that goal thus far. Thankfully, everyone is finding a lot of value in participating in this group. And then, as I mentioned earlier, we would love to expand our pantry program to support at least one food pantry physically located in every Westside United community. We recently also opted to have open quarterly meetings. So prior to, we had the food pantries, the hospital representation meeting on a monthly basis to share resources and touch base, make sure we are, meeting our goals, learn about new needs. And from those conversations, we learned that, our group was really interested in learning about other food access initiatives that are happening on the West Side. How can we connect to farmers and farmers markets and other healthy food retailers in the neighborhood if we need to purchase food items that we're not receiving from the Greater Chicago Food Depository. So we do have open quarterly meetings now, and I believe on the last slide I have that the date and time for you. And if you would like to be added to our email list to be included in that space, we are more than happy to have you. I'll share my email later and you can just let me know. So we're really excited about, building strong food systems on the West Side. This open meeting is a really good space to start or continue to foster some of those conversations. All righty. So we also have individual goals between each pantry and hospital, and it's really kind of up to each institution and pantry how they want to define those goals. The needs are different depending on the pantry, and the capacity to meet those needs is different between each partnership. So the conversations happen between each hospital and pantry, and you decide how to move forward. So some examples of things that we've done, Lurie and our partner pantry, Emmanuel in Belmont Cragen, Circle Urban Ministries, Mission of Our Lady of Angels is a newer pantry, so we haven't done much with them just yet. We're still in the needs assessment phase, trying to figure out where we can plug in. But some of the things we've done with Emmanuel and Circle Urban include community benefit grants. So, we had some additional funding that we were able to provide through those community benefit grants that nonprofit hospitals have access to. We also provide volunteers on a consistent basis at both of those sites. I know Rush and Beyond Hunger have been doing some health screening and food surplus programs. There have been food donation programs and infant supply donations that have happened. Cross-promotion of events and programs. We're helping Emmanuel develop a website. I know Ascension and European American Association are working on connecting food pantry clients to the Westtown Health Market that's happening over there. So there are a lot of possibilities for partnership outside of the key pantry characteristics that we all work on collectively. This is a model that can surely be replicated. Other hospitals can replicate this model. Universities could replicate this model. Community-based organizations that have an interest in food access and want to partner with a pantry could also replicate this model, or a pantry that's interested in partnering with a community-based organization or a school, could certainly start these conversations as well. So we do have resources available, and I'm more than happy to talk folks through the process and offer support if you were interested in testing the model. And you can definitely start small, start with 1 or 2 goals and build upon that. But one of the first steps would be identifying your partner. You can always go on the Food Depository website and use the Find Food tool to see where your local pantries where some local pantries are to you. There's contact information on there so you can reach out that way. So you could set up your introductory meeting and see if they're interested. We have a needs assessment tool available, so you can kind of go through and see what some of the existing needs are and determine if the partnership is a good fit for both parties. And then you can have a planning meeting, of course, as your next step, and figure out exactly what you will be working on, strategize around, where you can help meet need. And then we always suggest creating a memorandum of understanding. So most of our institutions have MOUs with each of our pantry partners that very clearly outline the roles and responsibilities of each party. And, once you determine that, you can create an action plan. So really laying out some step-by-step strategies on how you will achieve the goals that you've set together. And then, of course, follow-up meetings as needed. So, again, this information is available. I have it on a shared Google Drive now. I can share the slides with you all and make sure that you have access to those. And like I mentioned earlier, if you're interested in learning more, please don't hesitate to reach out to me and ask questions. We want people to replicate this. It's, something that we hope to scale up and grow in the future. So. All right, I have a few. Oh, am I going too long? Okay, I saw your camera turn on and I got scared.
You're good. No, go ahead. Thank you.
All right, I just have a few lessons learned and barriers that I wanted to touch on. So you can see everything listed here. Obviously, funding is essential to build capacity. The work cannot happen without the dollars. So accessing funding to support your work and getting buy-in from your organization or institution is really, really important. We've also found that needs and goals should be identified together. We don't want the institution coming in and saying, here's what we're ready to provide. You really need to work as a partnership to talk through what the needs are and identify strategies to meet those needs. Space to share is valuable. Our monthly meetings has been an amazing learning space and great way to just stay up to date with current events, current needs. Pantry shoppers are also very receptive to education and resource sharing. Anyone that is wanting to share information or provide screenings, that has been a really great space for us. Oftentimes people are waiting in line for quite a while to receive their food items. So since they're already there waiting, they're often very happy to pass the time by talking with you about a nutrition topic or learning about a new recipe. So if you have a program that is education focused, that's a great time to talk with people. Or if you're trying to recruit folks to a program, that may also be a really great time to talk with folks. The program is mutually beneficial to both parties involved. Food access goes beyond charitable food programs. And if you are interested, you can be the advocate within your organization. I push really hard for this program within Lurie. It is something that's very near and dear to my heart. So I, advocate as much as I can for our partners. If I see dollars come in, I will always say some of these dollars, can they go to my food pantries? My food pantries need funding. So always, being an advocate for your program within your institution and pushing things together, engaging with the teams in your institution. So I've worked with our Healthy Communities teams and some of our other communities programs. I work with our volunteer team at the hospital that works with our employee pool for volunteer programs. I've talked to folks that recruit outside volunteers for programming. I've talked to information management and our social service team, food programs. So it's really important to engage with the appropriate departments and gain that buy-in from your institution. And then some of the barriers I listed: pantry staff and volunteers are busy. If you work at a pantry, you already know this. They're often volunteered or paid very little. So having capacity to participate in meetings and planning and things like that sometimes just isn't realistic. Case management and closed loop referrals are not currently reimbursed right now. So, that's something that we're working towards. And then another barrier is inclusionary practices for non-English speaking shoppers. So, we have materials available in Spanish, but folks speak a multitude of languages, and that has definitely been a hiccup when trying to provide education or collecting feedback and doing evaluation. Oh, thank you, Jess. I just saw it in the chat. All right. So now I believe it is time for you to ask me any questions that you may have. And then if you don't have any questions for me, I have questions for you.
I'll just start, not a question, Megan, but thank you so much for that wonderful presentation. Like Jess echoed in the comments, it's been amazing to see this program grow at Lurie because of your advocacy. So thank you so much for everything that you're doing. Yes, and I'll turn it over to anyone else who might have questions for Megan. One question that I know we've talked about a little bit, Megan, and some of the work we're doing is maybe what you've learned specifically about the referral process. If you are doing referrals from Lurie to food pantries, or even with the food pantry you're working with, if they're receiving referrals from other healthcare organizations, how you've helped support them in building capacity for that referral and advocating for changes within hospitals and healthcare systems who are making those referrals.
Yeah, so that's a very tricky process, and it looks different within a little bit different within each institution, depending on what program you're using for referrals. I will say for on the pantry side of things, Lurie has a referral program that is currently running called the All Hands Health Network, which is a community referral program. So they work in the 60651 and 60639 zip codes, and they screen families and they refer to all kinds of resources, even outside of food access. So I was very lucky in that this program was already starting at Lurie. So I was able to tap in with them. So they already had some expertise in providing trainings around closing the loop with Unite Us, which is the program that Lurie is using. So I was able to tap into that team to help identify and work with our pantry partners and provide trainings on how to use the Unite Us program to close those loops. I also, push to make sure that there's a stipend available for those pantries so that they can be reimbursed for their participation in doing so, because it is a time commitment, and, people should be compensated for their time if they're going to be spending it on your program. So definitely advocating that, anyone that's participating should be paid to do so. I would also and then through the All Hands Health Network, they also get paid out on the back end. So they get an upfront stipend, and it's not a very large stipend right now. I see somebody asked in the comments here. It's $1,500 for the pilot as a startup stipend, and then they also get reimbursed by closing the loop. So the number of referrals that are closed through the program, they get paid out on the back end as well. And All Hands takes care of that. So I'm not entirely sure what how that all shakes out in the end. So definitely compensation for participating is something I would highly recommend, especially for your pantry partners or any other social service organization, because you can certainly do this outside of the food space as well. Within Lurie, I think, the timing is good because the screening for social determinants of health is a focus for us as an institution. So it's finding the right folks to talk to on your team. And I am still at the early stages of all of this. And, luckily I work with a team that is very open to new ideas and talking through some of this stuff with me. But I mentioned some of them earlier. Start having conversations with your information management team, your social service team, and just learn about what the options are. And once you get an idea of how the processes are done within your institution, you can determine what the next steps may need to be. Do we need funding because this is going to take a lot of staff time? Do we need to create new systems? Is it as easy as just putting an icon next to the name and letting folks know to choose the pantry with an icon? No, it's not, but start having those conversations, and then you'll get a better picture of what direction you need to go. Oh, my bad. Any other questions? Now, Lucy, I don't know if you want me to ask some of these questions that I had. I know that you had like a section carved out for a discussion.
No, why don't you launch us into discussion,
Okay.
Megan? I'd love to hear what questions you have for the group, because we have a great mix of folks who represent many different food pantry partners, hospitals and healthcare systems, and even others on the line.
Okay, so yeah, I can modify these questions just a little. So I definitely am curious if you partnered with a food pantry, and if so, in what capacity? And I guess the flip side of that is, if you are a food pantry, have you partnered with another community-based organization or institution to receive support? And if so, what does that look like? I think I'm always looking for new ideas for partnership opportunities too, outside of the things that we've already done. So always excited to hear about like creative partnership things.
Megan, this is Lamar from Advocate Healthcare. And normally we would have other team members that host our food pharmacy. So we partner with the Greater Chicago Food Depository, but it's called a food pharmacy. So it's actually geared that physicians identify patients who, who they think may need access to healthy food throughout the year. And so currently the food pharmacy program, and then we also have our diabetes prevention program. Those participants are eligible to participate in the food pharmacy, because food is medicine, food pharmacy program. So what we do is we partner with the Greater Chicago Food Depository. Our coordinators and team leads, they select the healthy food. There's 2 distributions a month at both Trinity Hospital on the southeast side and South Suburban Hospital in Hazel Crest. And the coordinators, they order the food and the participants pick it up. And it's just a drive-through food pantry for the most part. But what you're doing is very, very interesting. You're taking a pantry into the community, which I thought was really interesting.
Yeah, I think one of the benefits, and I mean, this food pharmacy program sounds amazing. I know GCFD has been a great partner in supporting our work with this model too. And I think one of the great parts, and I guess I could have put this maybe in the lessons learned, is partnering with an existing pantry is really, so beneficial for the community, because they already have those deep roots.
Mm-hmm.
And people feel safe in that space. They are, already attending. So, working with those those groups to just help, lift up the work that they're doing, rather than coming in and saying, here's what, we think should be happening over here. So we're going to make a pantry and this and that. It's been really beneficial to learn from our pantry partners and make sure that we're truly addressing what the community wants.
Right. And they also do the questionnaire the social determinants, the screening process, and even our folks on our mobile health units, they do the health screening questionnaire to determine if someone would fit the need for our food pharmacy. So I think the work that we're all doing is very, very good, but I just wanted to share that with other folks.
Awesome, thank you. Would anybody else like to share?
I don't want to put our partners from Swedish in the hot seat, but I know Swedish is also doing some amazing work with local food pantries in their area, similar to Advocate, where they are working with food pantries to create resources for patients who are screening as food insecure. AK, I'm not sure if you're still on and want to supplement what I just shared, or if you are in a place to share more information. Anyone else have feedback for Megan about the partnerships they formed with either hospitals or healthcare systems or food pantries?
Hi, this is Katara. My my program is VeggieRx. I work here with Chicago Botanic Garden, Windy City Harvest, and we partner with Lawndale Christian Health Center over here, right down the street from us on the west side of Chicago, and also PCC Community Wellness. Um, to provide fresh fruits and vegetables to people who are experiencing food insecurity or have a diet-related illness such as hypertension or diabetes. We don't really partner with a food pantry, but we do partner with a wholesaler who has been very, very helpful for us, especially since our program has grown so much. And that wholesaler is Midwest Foods. So they actually are the ones that pack out our VeggieRx boxes, and they also prioritize local produce and also prioritize produce that's coming from Black and brown farms, so that we can also serve people who are, serve our audience, but also give back to those farmers to put, financial gain for those farmers. And yes, we also partner with Good Food is Good Medicine, Janine, and Jenny, who also comes here and provide nutrition education for our participants.
Amazing. I would love, and I'm not sure what Midwest Foods capacity is, but I would love to talk with you about your partnership with them and how we can potentially, connect some of our pantries.
Yeah. And
Mhm.
they started really doing the produce boxes during the pandemic, so in 2020, because a lot of the business with restaurants has slowed down, so this was something that they kind of picked up, and a lot of people are now accessing them for help with produce prescription programs and just getting out food boxes. So I can put Alex information in the chat if you ever want to reach out to her and just talk more about like their process on their end, and if they have the capacity. But I would definitely love to talk to you more about our partnership too.
Awesome. Thank you so much. I think I may have met you at the farm on Ogden. Now I'm like taking a closer look at your little thumbnail there. Forgive me if I'm incorrect, but I would love to touch base.
No problem.
Megan, this is Jess. I had a question, and it may be that you're early on in the process to be able to answer this, but as it relates to the closed loop referrals that you're doing and the support that you're providing, I'm really interested in sort of like how the screening for food insecurity and referring, an individual who shows up turns into like household a household level intervention of food for folks. So I'm just interested in within the like referral process and the closed loop referral, how you all are structuring that so that even though it may be an individual who's identified within the health system, that the full household and family is sort of benefiting from the connection to the food pantry. Are there ways that that's logistically done through the referral process?
I'm not entirely sure what what you mean. I mean, I know like if we make a referral, you know, for one person from the family, when they go to the food pantry, they're asked, you know, how many people are in their household, and they are served by household.
Okay.
So I don't know if that addresses your question. Or if
Yeah,
it
I
can-
think that
okay.
this question stems from, I feel like, and I don't want to make overgeneralizations, but children's hospitals, I think, often have a little bit more of like a household perspective and thinking about referrals for these types of social service programs. Whereas, like, as we think about food as medicine types of programs being rolled out, which would include, you know, pantry referrals and other types of referrals, from a healthcare perspective, often the thought process is around the individual who has been screened and is then being referred to a program. So I guess I'm just curious if from the, and you may just not know the answer to this, but I feel like there's sort of more that broader healthcare can learn from children's hospitals or those that have thought about like the referral process not being tied to the individual who's screened, but rather the sort of need for that to be a family or household based type of program.
Okay. I think I understand what you're asking now. I don't have an answer for you. I'm very new to this process and just like getting my feet wet with the referral stuff. Emergency food and food access, yes, that's my jam, but the referral stuff is all brand new to this girl. So I am very much still learning about that process. There probably is somebody, and I don't know if Lindsay's still on, if she has more information. That you know, from our side that can answer that question, but that person right now isn't me. Maybe in a couple months it will be though. Sorry.
No, I didn't mean to
No,
put you
it's
on
all
the spot.
good. Then yeah, it doesn't look like Lindsay is on anymore. Yeah, she would be able to help for sure. And I think, you know, I have a meeting scheduled with our information management and social service team, so I will definitely make a note of that because it is something now that I am curious about. But yeah, it's still very new over here.
Hi, this is Rachel from Rush. Just can you, I think I missed a bit of what you were asking. Are you asking how they're able to determine not just the individual patient, but maybe the household food insecurity and being able to anticipate and address that? Is that what you're asking?
Exactly, and
Okay.
particularly sort of like through the referral process, because I feel like often within healthcare, that normally when someone's making a medical referral, they're making a medical referral for an individual to a service for that individual, whereas with food as medicine, often the need is the household. So I'm just curious how through the referral process, if y'all have learned anything about how to really facilitate that to be more of a like household or family level type of referral versus just the individual.
Yeah, got it. Got it. You know, I can say on at our institution, I can give you an example of how that happened. And I think it just kind of happened as I don't want to call it as a fluke, but really the interest and excitement of our nurse champion who was involved in our process probably about a year and a half ago. When the screening was conducted with a pediatric patient, that patient had come in suffering from malnutrition and some other medical needs. And through conversations with the guardian, with the parent of that child, found that the entire household was food insecure. That came from and surfaced from a conversation with either a care manager or a nurse. Somehow in our discussion internally, that's how they figured it out. And so when we were able to refer to make a referral to one of our vendors and have food delivered to them, it took into account the entire household, not just that individual. We haven't protocolized that at all. That is just one example of how, identifying that patient's needs. Obviously, it's a pediatric patient, so it would expand into that household. But I will say that my colleague, Julia Bassett, who runs our VeggieRx on-site pantry, factors in not just the referral to the pantry by the individual patient, but then she actually kind of estimates the impact on, say, she uses an example of like a 4-person household. And so the amount of food that is actually shared with that individual patient kind of, forecast that into like a 4-person household, how much food and how much that, like how much volume of food and then how much that costs. So I guess a long answer to your short question is we haven't protocolized that yet. We do think that that's important, probably more so on our pediatric patients who are being screened, more so than our adult patients. I could see that being more of a focus because it's the household, right? The children aren't doing the grocery shopping. It's the adults who would be doing the grocery shopping if they have groceries or accessing the pantry if they need those services. So I would think that over time, we're probably going to protocolize that. But I do know that when we're estimating, and Julia, of course, has to estimate because she's talking to philanthropy and funders and all kinds of things like that. She uses kind of a formula that she's developed, taking into account if that patient who's referred is a single person, obviously their food can stretch 4 times as much. But if it's an individual who's being referred and they're in a household with 3 other people, the food would cover them for probably about a week to a week and a half. So we're doing it, but not necessarily consistently all the time, if that makes sense.
Yeah, that makes sense. I think in our instance, since we're, partnering with the pantries, and they do ask, at the pantry what the household size is. So I know the need is being met, but I understand the need to kind of still like track that on our side, especially if it's a program that is being funded or needs to receive funding through the hospital, our home delivery program, our medically tailored meal program, right? We would need to factor that in. And I'm sure that there is also a formula or process for that currently. But yeah, with the pantry model, I think it's just slightly different because the hospital is not providing those resources directly.
Megan, one question I wanted to ask you in your the feedback that you've collected from participants at the pantries. I'm curious from the work you've done, if you've asked participants who have been screened and then referred to pantries, what that process was like for them specifically, and if so, what you might have heard about what made that process either successful or challenging for them.
I wish I had that for you, but we are not there yet. We are not even making referrals yet. I mean, we are like broadly like to food pantries, but we haven't gotten that specific. We will certainly evaluate the process once we get things up and running a little bit better. But yeah, sorry, I don't have that information yet, but we will be following up to learn about their experience with the process, and then also need to figure out a follow-up process for the folks that don't end up at the food pantry that we've referred, right? So that's the other piece of things. Anything else as we wrap up? You want me to kick it back to you, Lucy?
Sure, I can take it back.
Right.
Thanks, Megan. I really appreciate your time and expertise on the call. If folks could give a virtual round of applause for Megan, that would be wonderful. And we will spend maybe the next like 5 or 10 minutes just chatting about some additional questions we wanted to pose to the group. And Megan, if you're able to stay on, it would be great to hear your perspective on these things, but I understand if you have to get going. So I think what Megan chatted about at the beginning of her presentation was how a lot of the work that they are doing in the pantry partnership model is already very much aligned with some of the food and nutrition benefits that are being laid out in the new 1115 waiver. And so the 1115 waiver, as a reminder for folks who are new to these conversations, This waiver is being proposed by the state of Illinois for approval by Federal Centers for Medicare and Medicaid Services. And basically, the waiver would allow managed care organizations in Medicaid here in Illinois to offer new food and nutrition benefits to eligible Medicaid enrollees. And like Megan previewed at the top of her slide deck, these are really exciting food and nutrition benefits that we know improve outcomes for patients and then also can help prevent the onset of more severe chronic diet-related illness. And so one of the questions we wanted to ask is from the perspective of this group. So as 1115 implementation is rolled out and knowing that it's talked about, the waiver itself has language in it saying that a big part of it will be hospitals and healthcare systems being able to screen patients for food insecurity and then extend them into or connect them to community-based supports. What is it that hospitals and healthcare systems can do to really help build the capacity of those community-based supports? So specifically thinking about building the capacity of food pantries to function as these community-based providers of meal and food supports for eligible Medicaid enrollees. So again, what is it the hospital and healthcare systems can do to help build capacity through implementation of the 1115 waiver for community-based groups like food pantries? That's the question we would love to hear feedback on today.
Can you repeat what the 1115 is, Lucy?
Yeah, sure, Lenora. So the 1115 waiver is going to allow managed care organizations in Illinois to flexibly use their dollars. They have to be budget neutral, but they can move some of the money that's in their budget to new food and nutrition programs for folks who are enrolled in Medicaid and screened as food insecure, in addition to having met some other criteria. And so the waiver allows these managed care organizations to provide these really exciting new food and nutrition benefits to folks who are experiencing food insecurity, who are enrolled in Medicaid. And one of the supports that's explicitly named in the waiver, as Megan mentioned, a big one that's relative to the conversation we're having today, is using those dollars to help hospitals and healthcare systems refer eligible Medicaid enrollees to community-based food and meal supports. And I can put a link in the chat to where you can learn more.
Yeah, that's a tough one for me to answer. I'm thinking someone from our case management would be better suitable to answer that question, or even work with case managers to identify the organizations and those patients who may be food insecure.
This is Beth with the Greater Chicago Food Depository, but used to represent the American Hospital Association, and I know what some hospitals and health systems in other states have done is to sort of ensure that their community-based grants that they're giving out are sort of aligned with what the needs are. So to Lucy's point, if there's capacity building needs, as well as potentially doing in-kind support around contracting and other things. So what are the gaps as these community-based organizations are trying to start to sort of get this kind of reimbursement from Medicaid? And I think so, and we've talked a little bit, Megan mentioned sort of like the stipends for being able to use Unite Us and the closed loop referral. So what's that sort of administrative support that these organizations may need from a capacity standpoint?
Yeah, that's a great point, Beth. Thank you so much. Does anyone else have any other thoughts about how hospitals and healthcare systems could give support to community-based organizations who are doing food and nutrition benefits And that could be even, I know we have some folks who are not necessarily directly involved with food pantries on this call, but are involved with other types of community-based food as medicine programs. If you could speak to any of supports that a hospital or healthcare system could provide to you to build your capacity to deliver those programs, we would love to hear your perspective.
Hi, Lucy, this is Philip at AHE Options. I should point out here that we were talking about the Medicaid waivers, that anybody who's 60 years or older is eligible for multiple kinds of nutrition supports through the Older Americans Act. It has, nothing to do with Medicaid or Medicare. And the major requirement is that you be 60 or older, and they should contact their local area agency on aging. In Chicago, it's the Chicago Department of Family and Senior Services, and here in suburban Cook County, it's us, AHE Options. And we have multiple nutrition options, including working with food banks, Greater Chicago Food Depository largely, but we have home delivered, we have congregate meal programs, we have emergency meals, we have senior farmers market programs, and now we're both in the city and here ramping up a food delivery program, grocery delivery program. So raw food items. So just want everybody to keep in mind that, the age delineation does make a difference.
Definitely. Thanks for plugging that in, Philip. And
Mm-hmm.
it's a good reminder of those other programs that exist that AHE Options is part of. I appreciate it.
Mm-hmm.
And I see Janine in the chat mentioned how they could weigh in about healthcare programs supporting the work that they're doing.
Yeah, hi. So right now with Good Food is Good Medicine, we are doing 2 research studies that are community based participatory research studies. One is with University of Chicago with the microbiome study that we're doing. And the other is with UIC with Dr. Lofton, the community of support for Black women with hypertension and high BMI. So we've already completed those, and they're still going to keep going on. But one way that has really helped us and can continue to help us going forward with these partnerships is the academic and research capacity that these institutions have. So we are happy to provide the cooking and nutrition education and the food justice part, but being paired with MPH students and residents and community champions who are helping us with our data and metrics, and also including us in their as co-authors on what they're publishing helps immensely, because it just gets the word out better about us. The information helps us, it validates what we're doing, and it is stuff that we don't always have the capacity to do unless I have an intern, which I do right now, but maybe not. Maybe I won't have one forever. So that is that has been gold as far as our partnerships with hospitals.
Absolutely. Thanks, Janine. I think you named some really important points that go both ways. Like, we have heard that hospitals and healthcare systems would love to be linked with organizations like yours, and have also wanted to know about outcomes for their patients. And so I think that this is really complementary work that you are both interested in receiving, and work that the hospitals and healthcare systems have expressed interest in doing. Anyone else have final comments in the last couple minutes of our call together? All right. Well, thank you so much, everyone, for your participation today. I really appreciate it. Thank you again, Megan, for your presentation. It was wonderful to hear about the work you're doing. We are really grateful for everyone's time and expertise on the call. I won't pull up my slides, but I'll just remind folks that our next food work group meeting is scheduled for Thursday, October 26th at 10 a.m. And if you are also part of our Food as Medicine subcommittee, that group will be meeting on Wednesday, October 11th at 10 a.m. If you don't have those invites on your calendar, please do reach out to me and I'm happy to get them to you. But again, just want to echo gratitude to everyone's participation on the call. We hope everyone has a beautiful day and a great end to the week. And we will see you all very soon.
Thank you.
Thanks, Lucy.
Thanks, everyone.
Thanks.
Great meeting.
Thanks.
Thank
Bye,
you.
everyone.
Thank you.
Everyone.